I think public health is the convergence of a lot of disciplines in a way that always really comfortable space for me, but also really appeals to my worldview because it's about larger systems at play. It's about policy and organization and environment, but it also is very much about personal worldview, culture, belief systems, behaviors. And I appreciate that it requires that sort of holistic thinking. It really converges both the way that I want to see the world and the way that I want to operate in the world and the way I want to contribute professionally and personally. So I think that's what makes it personal for me, is that it educationally, theoretically, professionally, it just makes a lot of sense.
That was today's guest, Lauren Rauh. Hello and welcome everybody to Making Public Health Personal. This podcast is brought to you by the CUNY Graduate School of Public Health and Health Policy in New York City. I'm your host, Laura Meoli-Ferrigon. Thanks for listening. In today's episode, we're going to hear the inspiring story of a CUNY SPH graduate with a personal commitment to health equity, who was able to navigate an impressive career change during the height of the pandemic. Lauren Rauh is the program director of the New York Vaccine Literacy Campaign at CUNY SPH, which partners with community-based organizations to increase vaccine uptake through tailored education and communications. Now in its second year, the VLC is expanding their model to address systematic challenges around resources and information for preventative healthcare, and exploring strategies for rebuilding trust in institutions, systems, and information in today's post-pandemic world. We'll discuss the future of the VLC and how Lauren and the team partners with other organizations to do the best work possible in collaboration with communities. Lauren will also share tips for evolving professionally and finding new opportunities in the quickly changing world of public health. Thanks for joining me today, Lauren.
Thanks for having me.
So tell me about your career change. What were you doing before you returned to school in 2018 to pursue your MPH?
Well, interestingly enough, I was working as a chef in New York City. I had worked in various positions for about a decade. The longest and the last job I had was at Brooklyn Winery in Williamsburg, Brooklyn. And I was running a really busy food program, a mix of wine bar, which was a small plates restaurant, and also a busy events program, which was really their bread and butter. And I have to say, I absolutely loved it. But if your passion for cooking starts to wane or drag, or your body starts to hurt too much, or the days start to feel too long, then working in the food industry is just not sustainable. And I started to feel those things in my last couple of years. I also simultaneously had always been working in healthy food cooking and nutrition education through some volunteer work, but also through a part-time job with the Department of Health, where they do nutrition and cooking education at farmers markets. And that was really my first toe dipped into the public health world. And I started to think, well, I really do enjoy this aspect of a lot of the cooking work that I'm doing. I enjoy the educational aspect. I enjoy the interaction with community. And maybe I could do more of that. Maybe that's what I need to be pivoting into. And that's really why the shift to public health.
And your timing was incredible. I mean, you left an industry that suffered greatly during the pandemic.
I know, it was ironic in the worst and best possible way. It was something that I would joke about with my friends who were in the industry, and luckily most of them are back at work or found other jobs since. But it was kind of absurd that in my final semester at CUNY SPH, a lot of faculty would say, finally the world knows what public health is. And so I found myself in that space and watched my former profession really just literally shut down. Luckily, I think there were a lot of businesses that suffered and some of that has been sustained. But at least in New York City, I really enjoyed seeing that. I think there's been a return to some of the vibrant industry that was there before, the food scene that was there before. But yes, it was timely to say the least.
Yeah. And how did you get interested in vaccine literacy and public health communication?
So my first exposure to vaccine literacy and sort of the concept of vaccine hesitancy and behavioral and environmental and educational and systematic reasons why someone may have wavering confidence was really through coursework, but also because my time at CUNY SPH coincided with the measles outbreaks that were happening in the Hasidic communities in Brooklyn and then also in Rockland County. So it was a very timely issue and also for me a new concept of diseases that we've sort of taken for granted, having been eradicated or largely protected against, were resurging. And I was very fascinated by the sort of individual behavior elements that might have been in play there, but also sort of the larger phenomenon of vaccine hesitancy. So my time at CUNY exposed me to a lot of topics and concepts and theories that I had never, ever, ever been exposed to before. And vaccine hesitancy and confidence and that research was one of those. And I really took hold, and I found myself both wanting to learn more and write and read and research all about it.
And what was your expectation or prediction for your post-MPH career? How did the pandemic change what your plans were?
I truly cannot remember if I had a clear vision of what I wanted to do post-graduation, at least in terms of a dream position or a dream role. I did see myself going into more program and project development. That's always sort of been part of the story that I saw for myself transitioning out of the food industry into public health, because those were the transferable skills that I felt I could confidently bring to a new career. All the elements of what actually happened spring 2020 and beyond, I could never have predicted. I was lucky to be included in a faculty-led public opinion survey project that we conducted from March of 2020 all the way through August, and then it has been repeated at certain intervals in the last couple of years. Never in my wildest dreams did I think that I would be, a member of a robust survey team and have all this experience, both creating, implementing, and analyzing survey data. Also, that work really led to other grants and being able to coordinate mixed methods research in a way that I don't think I really imagined that right out of school I would be so deeply involved in. So first of all, I don't know if I had clear expectations, but what did end up happening was that I got exposed to a lot of diverse experiences and skills in a way that really exceeded my wildest dreams, because I feel after 3 years, the skill set that I've been able to build has been incredible. And I feel so fortunate because there's just been a whirlwind of experiences that I've been able to be included in.
If you dream of making a difference in the world, a public health degree or certificate can give you the tools to do just that. The City University of New York's Graduate School of Public Health and Health Policy equips public health professionals to advance not only a healthier New York City, but a healthier world for us all. We want you to join us in our mission. Visit sph.cuny.edu to learn more about our programs. No matter where you are in your career, CUNY SPH offers a broad range of degree and certificate programs to not only help you advance in your career, but to have a real impact on the world. Public health professionals are needed now more than ever. Join us. Visit sph.cuny.edu to learn more.
CUNY SPH did so much in response to the pandemic and now is in a space to reflect. How do we continue to build upon what the VLC has accomplished so far?
That's a great question. I think there are a lot of initiatives at the school that blossomed over the last 3 years that have a lot of potential for sustainability, just based on the lessons learned of sort of what was lacking from the ability of the city to respond to the needs of the community, the needs of the public during the pandemic. For the vaccine literacy campaign specifically, because that's what I can speak to most confidently, our model is something that I'm really proud of, and I think is something that can be transposed to a variety of settings, because essentially, our model is to partner with community-based organizations and have them take the lead in the development of tools, resources, materials, educational modules, campaigns, you name it. Really take the lead in developing those based on their entrenched knowledge of what the community needs. And so we're there in a collaborative role, in a supportive role, and for the last 2 years, it's been around COVID-19 vaccination and now vaccination more broadly. But that topic could be switched out for a variety of health literacy issues and topics. I mean, there are unfortunately a lot of health access, health education, health literacy issues, especially in underserved communities, that would benefit from that supportive collaboration. And why not empower and give voice to and build the capacity of the organizations who are already doing that work every day? So I feel very convinced that that model is worth replicating and worth sustaining. And we are hoping to do that with sustained funding to build out a health equity and literacy program with the cute acronym of HELP, because it's public health, so you need an acronym, right?
Yep.
So with the acronym HELP, this will be a broader version of the VLC and will fit nicely across a lot of the other initiatives that are happening at the school that could benefit from this sort of implementation arm to develop health literacy tools. So that's the plan and that's the vision. We're working on proposals and starting to get the word out. But right now it's still vaccination all day, every day. And we still have willing partners, believe it or not, who see the value in talking about it. And also agree that this is a moment when we can leverage the sort of national conversation about vaccination. So we have a lot of exciting stuff coming up in the spring and summer.
That is very exciting. And how does vaccine literacy fit into preventative healthcare?
Vaccination, for the most part, is about prevention. There are some vaccines that you can receive after being infected, but for the most part, it is about preventing the infection to begin with, or in the case of COVID-19, as we all experienced in real time, about preventing serious disease and death. And if you look at the larger health system and sort of culture around healthcare in the United States, it's mostly focused around treatment and response to symptomatic illness, which, that's a topic for a whole other podcast, but I think that's quite problematic in many ways. And in some ways leaves vaccination as an outlier and leaves it very vulnerable to things like mis and disinformation, just low levels of understanding and literacy around the purpose and what vaccination actually does, because largely prevention is not the way we think about healthcare. And I think that's changing in some ways, especially around like nutrition is often talked about as prevention, or an exercise, live a longer life if you do X, Y, and Z. So it does fit in there, but those types of things sometimes get kind of boxed up into the wellness realm. And so vaccination does sometimes feel like it really stands out because it's something you're asked to do before you display any symptoms. Mm-hmm. And if it's doing its job, you can live your whole life without ever even being exposed to or even realizing the disease exists. I mean, that was until very recently. There were generations that never had been, at least in the United States, generations of people who had never heard of a case of polio. It was, it was a historical disease. That's where it fits in prevention. But I think, unfortunately, there isn't a place for it in the way a lot of people think about healthcare, especially if we're asking people to think about it as much as we have been in the last couple of years. For a very long time, it's just what you did, right?
Yeah.
We have this great partnership with a senior center in Central Harlem. And in conversations with the seniors, we've done presentations there and we've done some data collection and focus groups. And that's what they always say. They say, why is it, my mom the whole family went. That's just what we did. We all went together to get vaccinated. It wasn't something you really questioned. And it was one of those sort of things to check off the list, of all the, who's going to school this fall, let's make sure they have X, Y, and Z, like backpack, vaccinations, pencils,
Yeah.
And I'm not saying that that's changed across the board, but the conversation has gotten more nuanced. And so that means that there needs to be an empathetic response system to help people think through those things when they've never had the chance to or had the opportunity to before, or suddenly feel pressure to question something they never questioned before. I mean, that can be kind of scary, right? If you thought something was something that everybody did, and now you've been asked to have questions about it.
I think we definitely take it for granted because we all just had to get vaccinated, and it still is a requirement to go to school, to go to college, to go to elementary. And I think we maybe had a question like, what is measles? What is mumps? Because we've never seen it before. But we have to get this vaccine. And that's the only time we ever see those words is when you have to get vaccinated for it. But I think now that people are actually getting exposed to some of these diseases, it's questioning like, well, I never got mumps or measles in my life. Why should I need to get a vaccine for my kid? Well, you didn't get it because you had the vaccine. And everyone has had it.
Exactly. It's interesting. The one-on-one conversations are the space where you can really tailor to people's questions and concerns. And like what you just said, the areas where they think, wait a minute, and they just need some clarity and confirmation, right?
Mm-hmm.
It's the national sort of public scale conversations that are really challenging because there are so many voices and so many conflicting voices at the table and so many, unfortunately, ulterior motives. I mean, the mis and disinformation machine is a multi-million-dollar, if not billion, but I'm not sure because I haven't run the numbers. It's a very lucrative business. And so there are a lot of people who stand to benefit from people jumping on the questioning, scare tactic bandwagon. As a result, I think there needs to be more opportunities to have those conversations on a smaller scale and really let people voice their questions and concerns. And at least what we found, especially around the COVID-19 vaccine, because the COVID-19 vaccine in some ways will always be a bit of an outlier because I don't want to say will always, but I'm hoping it will stand out as a particular case in vaccine hesitancy, questioning those types of things, because there was a lot of anxiety and polarization around COVID-19 already. And then introducing a vaccine into the mix where we were all brought along for the ride of vaccine development in a way that in my lifetime I've never experienced. Maybe H1N1, but I don't,
we know too much about it.
I don't know too much. It's a different information age. Even different than it was in, with H1N1 in 2009, 2011. I mean, maybe I was paying less attention then, but I also don't think that there was the same sort of broadcast play-by-play of what's happening in the vaccine development. And there are a lot of things that were different about this time around. I mean, the coordinated national response, the resources, all the things that allowed the vaccine to be developed as quickly as it was. So all of those things combined create a very unique environment. The COVID-19 vaccine brought up more questions and concerns given the very unique environment surrounding it. And the people receiving those questions and concerns, especially if we're talking about what's happening at sort of individual or local level, were community-based organizations, the ones that were having face-to-face time with individuals, direct service organizations. And these organizations, some of them are health trained, community health workers and clinics and things like that. But many were providing other services and not trained to talk about health and talk about health communication topics. And so recognizing that frontline worker became the, on everybody's lips, everybody suddenly admired frontline workers and knew what frontline workers were. I've never heard that phrase in my life, I don't think, before the pandemic. We're quick to praise and then didn't necessarily think about, okay, if the frontline workers are the ones fielding all these concerns and helping to answer all these questions, why are we not making sure they're actually prepared to do so? And so that's really where the concept of the vaccine literacy campaign came in. And I think sustaining that moving forward will help any sort of fallout or backlash we have moving forward of sort of what the information environment is now.
How do we equip our communities and community leaders for the next pandemic? Because misinformation is out there and the community leaders are the ones that can make some real change. So how do we prepare them for the next inevitable pandemic?
You're totally right that, the information environment is what it is now. And I think, as you said, unfortunately, the inevitable next pandemic, unless there's a lot of concerted effort in changing the communication infrastructure, how messages are developed and sent out, who gets to talk to the public about certain things, who hears back from the public and responds, unless that's pretty heavily revamped, I think we're kind of in the infodemic age forever. The internet isn't going to get smaller, if that makes sense. I mean, that shows how much I know about the internet. Unless there's heavy censorship happening we're not going to suddenly have less information at our fingertips.
Yeah.
And there may be ways to have better information at our fingertips, but the bad information, the sort of predatorial disinformation being purposefully put out there for others, usually monetary gain, that's not going to necessarily go away. Well, I don't want to say that. I want to have faith that there are mechanisms that we can put in place to combat it. But I think to some degree, it's the nature of how information is both created, sent out, and consumed now.
Mm-hmm.
And if that's the muddy waters that we're all in, then understanding how to create clear communication channels, and these would be feedback loops, it's information, it's communication out, but it's also receiving whether or not that communication was understood, received well, leads to actual comprehension of next steps and actions and mitigating measures. That needs to come back as well. And so I know I'm being very vague, but I have an example of this too. I think since we were talking about how communication at an individual or local level or a tailored level can often be the most impactful in actually helping people feel heard and understood and have their questions answered, then those channels and feedback loops should first be created at the local level. So exactly what we're doing with community-based organizations. So for example, one of our longest partnerships with the vaccine literacy campaign has been with Hunger Free NYC and their COVID-19 vaccine outreach team. Such a wonderful group of people, so entrenched in the community, so hardworking, but their primary role prior to the pandemic, and especially during the pandemic, was connecting people to SNAP and WIC benefits. They help people determine their eligibility and receive food assistance. So these community workers, this community workforce, and the individuals who sort of oversee the teams are not trained to talk about vaccination. But of course, what did their clients want to talk about the minute the eligibility was determined? They wanted to know, did you get it? Are you going to get it? I'm afraid it's going to hurt my children. I'm pregnant. I can't really get a straight answer on whether or not it's safe. That's what they want to talk about in these client meetings. And so they came to the vaccine literacy campaign with reams of questions that they felt, unless they were going to start doing this as another part-time job, they did not have time to find this information. And two, didn't feel prepared to vet the information, make sure that they were getting the right information back to their clients. So with that feedback, okay, here's what we need help with, we were then able to create a resource for them for these client interfaces. This came in the form of a few things. One was a toolkit that we created, a slide deck with information and links and resources. And also we've done a series of webinars with them, which would have been great. Our webinars with Hunger Free NYC are always the best attended. I mean, one of them had 500 registrants, which shows their reach, and shows their trust. I mean, their clients trust them and they work closely with schools and PTAs. So that's an example of that. So once the toolkit was created, then we send it back, we get feedback, it gets revised, and that loop is created constantly. And we're still doing it. We just put out new revisions this week. So that's a really small example of what I mean, but I think there are ways to scale that up. And there are ways that scale that up at the agency level, the Department of Health level. There are ways to scale that up at the community board level. That's what I think we need to be investing in now and thinking more about creating now in preparation for the next, as you said, pandemic, which I hope we have a lot of time to prepare for that.
I hope it's not in our lifetime, unfortunately.
That would be great. Oh my gosh, we could spend the rest of our lives just making sure everyone else is prepared and not have to actually worry.
Yeah, haven't we had enough, really?
I'm down for that. I'm all about I am a full convert to preparation and preparedness. Yep. I'm all about that. I don't need to experience it again though. I'm good.
So tell me about the project you're doing with the Boys and Girls Club of Harlem.
Yes, I'm so excited about this. We are partnering with a group of 16 to 18-year-olds over the course of 6 weeks. We're meeting once a week. And in these meetings, we will do workshops together to co-create a educational resource for their peers to learn about HPV and HPV vaccination. These workshops are very open, very brainstormy, storyboarding, lots of art projects, things like that. And we're starting from a very pie in the sky place. You know, you dream it and we'll talk about it. Maybe we won't design it. This is a very DIY, very low tech series of workshops, but we'll talk about it. We'll dream about it. And then the goal is at the end of our 6 weeks together, we will have some sort of prototype of this tool. So in 6 weeks and with our capabilities, we're not going to create an app together or anything like that, but we might create the sort of storyboard that would need to be behind an app. I have a fieldwork student working for me, and she brought up a great point that they'll probably want to create a TikTok, which I am totally excited about, but I would have no ability to contribute to. So I feel like I'm going to learn a lot from this process.
Yeah, they would be perfect for it.
Yes, it's an open book. And it will also be an opportunity for these 16 to 18-year-olds to express what they want to learn more about as well. It's quite possible that many are coming from a place where they know very little about HPV and HPV vaccination. And so it's an opportunity to learn together, to co-create together. And then we'll have this product that will be available to them as now newly minted vaccine literacy peer educators. And it'll be available to the Boys and Girls Club, and also a feather to put in our hat at the VLC as well. So if you can't tell, I'm pumped. The staff that we've worked with so far are really excited, and it just seems like it's going to be a super supportive environment.
Oh, that's great. I love the Boys and Girls Club. So really exciting that you get to work with them. So what most excites you about your role and the future of your program?
Well, my role has really evolved over the last 3 years, but in my current role, I've really enjoyed deepening some of the partnerships we have with community organizations and imagining these more engaged, robust projects that we can do together. That has been very rewarding, and I'm really looking forward to what we have planned in the spring. I also enjoy working across different initiatives at the school and being able to think about ways to synergize the work that we're doing. I mean, there's so much good work happening at CUNY SPH. And I think especially, fingers crossed with help, I think that ability to work across and support each other and synergize efforts will just be magnified. So I'm very thankful that in my role, while my day-to-day is vaccine literacy campaign day in and day out, I do feel very closely tied to the other community engaged work at the school and very appreciative of points to collaborate and hopefully more collaboration in the future. Having worn many hats in the last 3 years, something that I really enjoy about program direction is the strategic operational thinking. Yes, there is elements of the day-to-day administration that are inevitable and super important, but it's also important to constantly be thinking about the evolution of the program. And I really enjoy that. And I'm happy to see some of that thinking start to play out. That's been a great opportunity of this role, particularly.
And your ability to evolve professionally, do you think that's informed your ability to run a program that has to constantly evolve?
Some of my ability I like that you called it evolve professionally. I think that
or adapt, I guess.
Adapt, yeah, or, a blunt way to say it would be roll with the punches is being from a very dynamic industry previously. I mean, the food industry, no day is the same. And you can feel very confident in your position in the kitchen, and the rug gets pulled from underneath you constantly. That's also a product of working with really small, nimble teams too. I mean, the VLC is a tiny staff. We always have been. We do, during the semesters, we have students who work for us, which build up the capacity of the team, but students graduate, and which is great. But it also means you're constantly shrinking and growing your team, which is dynamic and can be a little disruptive too. Turnover is disruptive. So I think I was well prepared for what it would be like to work on a small team. And also, I think a lot of people had to adjust to that during the pandemic too. No day, week was the same. You might map out the needs of your program for 6 months and halfway through realize that you're in a completely different environment. So yes, I think it was both being prepared to be adaptable or being adaptable already, and then just having to, given where we're all working now.
So as we wrap up, what advice do you have for other people looking to change careers or get involved in their community, but they're maybe afraid of change or don't know how to begin making a shift like that?
So in the food industry, you never feel like you have time to do anything other than work, which is, not necessarily wrong, but
Yeah.
it's very easy to convince yourself that you only have time to work. So if someone was in the food industry, I could understand why this would be unrealistic, or someone working in, a very time-consuming job. But if you can carve out time to volunteer or take on an internship or something to that degree to really test out where your next step could be, that will help you build confidence about whether or not it's the right move for you. Pivoting to public health was definitely scary, but I had exposure to the Department of Health and working with them and meeting colleagues there and sort of understanding what their paths were like. I had opportunities that allowed me to hear from others who had taken that move already. So if you can find opportunities it could even be, 2 hours a month or something, where you can talk to professionals in this potential new field and start taking on a little bit of the work to build your skill set, to see where your transferable skills are. I think that would be a great first step. And if you are ready to take the plunge to go back to school, my biggest advice would be to find faculty that you can and want to work with. Find ideally paid work with faculty. Yeah. You can, because that was, while I enjoyed my coursework and I learned so much through my coursework, I saw the practical application of what I was learning in school and the practical application of the things I had already built in my career once I was in actual jobs with faculty. It's an opportunity for some mentorship too, which for me, I was really craving. And so I was so privileged to have had some great mentors at CUNY. It really helps ease some of the fears of that transition, because it is scary, especially I went back to get my MPH later than I would say most of the student body did. But CUNY is a great space to do that, because there are people who are well into their careers, well into their 50s, 60s, who decide to go back for their advanced degree. So I didn't feel like an outlier, but I definitely was older than most of my classmates. And that can be scary, because in some ways you feel like you might be starting from scratch. And I think these internships, mentorships allow you to see that you're not actually starting from scratch, that you're building on something, and there's a way to tell that story. Even if it's just to yourself, there's a way to tell that story to make you feel more confident.
Yeah. And definitely it gives you opportunities for networking, for building your resume, even if it is a volunteer experience. So that's really great advice. Thanks again, Lauren, for being a guest, and thanks for listening to Making Public Health Personal, presented by the CUNY Graduate School of Public Health and Health Policy in New York City. You can now share, like, and subscribe to our show on Spotify, Apple Podcasts, Google Podcasts, Amazon Music, Audible, and on our YouTube channel. To find out more about CUNY SPH, you can visit sph.cuny.edu or connect with us on social media. We're on LinkedIn, Twitter, Facebook, and YouTube. Just search CUNY SPH. This is your host, Laura Meoli-Ferrigon, signing off. And while public health has a global impact, that doesn't mean we can't make it personal.